Hello there, subscribers of the audience. Today we will tell you about coronavirus. Let's get acquainted with the symptoms of coronavirus and COVID-19 from the beginning. Let's go.
COVID-19 may vary. Most infected people have mild or moderate symptoms. A. Commonly observed symptoms: increase in body temperature, A. Fatigue, A. Dry cough. A. Some infected individuals may also experience muscle and joint pain, nasal congestion, A. discharge from the nose, A. sore throat, A. diarrhea, A. On average, 5 to 6 days elapse from infection to the onset of symptoms, although in some cases this period can last up to 14 days. What is coronavirus? Coronaviruses constitute an extensive family of viruses with proven pathogenic properties in relation to humans or animals. It is known that a number of coronaviruses can cause respiratory infections in humans, ranging from the common cold to more serious conditions, such as the Middle East respiratory syndrome and severe acute respiratory syndrome. The last recently discovered coronavirus is causing COVID-19. What is COVID-19? COVID-19 is an infectious disease caused by the last of the recently discovered coronaviruses. Prior to the outbreak in Wuhan, China, in December 2019, nothing was known about the new virus and disease. How does the virus spread? You can get 2019 nCoV from other people if they are infected with the virus. The disease can be transmitted from person to person through small drops released from the nose or mouth of a COVID-19 patient by coughing or sneezing. These drops fall on objects and surfaces surrounding a person. Other people may become infected by touching such objects or surfaces first and then with their eyes, nose, or mouth. In addition, infection can occur by inhaling small drops that are released when a person coughs or sneezes with COVID-19. For this reason, it is important to stay at a distance of more than 1 meter from a sick person. Is the virus causing COVID-19 transmitted through the air? According to current scientific data, it is precisely the small drops released from the respiratory tract that are a more significant transmission factor than air. The answer to the previous question, how is the virus spread? By following simple precautions, you can reduce the risk of becoming infected or spreading COVID-19. Regularly wash your hands with alcohol-based products or wash them with soap. Why is this needed? If a virus is present on the surface of the hands, treating the hands with an alcohol-containing product or washing them with soap will kill it. Keep at least 1 meter away from coughing or sneezing people. Why is this needed? When coughing or sneezing from the nose or mouth, the smallest drops containing the virus are released, which the person spreads around him. Being too close to such a person, you risk inhaling these drops and getting infected from him, including a coronavirus infection. If the person is sick with COVID-19, if possible, do not touch your eyes, nose, and mouth. Why is this needed? Hands touch many surfaces and a virus can get onto them. Once in the hands, viral particles can enter the eyes, nose, or mouth. From these parts of the body, the virus can invade the body and cause disease. Both you and others should strictly observe the rules of respiratory hygiene. To do this, cover your mouth or nose with your elbow or tissue when you cough or sneeze. The used tissue should be discarded immediately. Why is this needed? The virus is transmitted through small drops. Strictly observing the rules of respiratory hygiene, you can protect others from viral diseases such as SARS, influenza and COVID-19. If you feel unwell, stay home. If you have a fever, a cough or difficulty breathing, seek medical attention as soon as possible. Follow directions from your local health authority. Why is this needed? The central and local health authorities have the most up-to-date information about the situation in your area of residence. Timely seeking medical help will allow medical specialists to promptly refer you to a suitable medical institution. In addition, you thereby protect yourself and help prevent the spread of viral and other infections. Keep up to date with the list of COVID-19 high-risk areas, cities or areas where COVID-19 is widespread. Whenever possible, refrain from traveling, especially if you are an elderly person or suffer from diabetes, heart or lung diseases. Why is this needed? In these areas, you are at increased risk of becoming infected with COVID-19. How to put on, use, take off and dispose of the mask. 1. The mask should only be used by medical professionals, caregivers, and those with symptoms of a respiratory illness such as fever and cough. 2. Before picking up the mask, treat it with an alcohol-based product or wash it with soap. 3. Inspect the mask to make sure there are no holes or damage. 4. There is a metal insert on the mask. Take the mask with the insert up. 5. Place the mask with the outside of you, brightly colored side. 6. Put the mask on your face. Bend the metal insert or the retaining clip in the shape of a nose. 7. Pull the bottom edge of the mask so that it covers your mouth and chin. 8. Remove the mask after application. Hold the mask by the elastic ear loops and do not touch it on your face or clothing, as the mask used may be contaminated with microorganisms. 9. Immediately after use, throw the mask into a resealable container. 10. After touching or ejecting the mask, hand hygiene should be done. Use alcohol-containing products. And if the hands are obviously dirty, wash them with soap. Can a person get COVID-19 from an animal? Coronaviruses make up a vast family of viruses and are widespread in animals. People are infected with these viruses and then transmitted to other people from time to time. For example, it was established that people were infected from civet, from one-humped camels. A possible source of COVID-19 among animals has not yet been established. As an individual protection measure, for example, when visiting livestock markets, direct contact with animals should be avoided, as well as touching surfaces with which animals come into contact. Strictly comply with food safety regulations. When working with raw meat, milk, animal organs, care should be taken to avoid cross-contamination of other products that have not undergone heat treatment, and in addition, you should refrain from eating raw or half-baked products of animal origin. Person get COVID-19 from an animal. Coronaviruses make up a vast family of viruses and are widespread in animals. people are infected with these viruses and then transmitted to other people from time to time. For example, it was established that people were infected from civet from one-humped camels. A possible source of COVID-19 among animals has not yet been established. As an individual protection measure, for example, when visiting livestock markets, direct contact with animals should be avoided, as well as touching surfaces with which animals come into contact. Strictly comply with food safety regulations. When working with raw meat, milk, animal organs, care should be taken to avoid cross-contamination of other products that have not undergone heat treatment, and in addition, you should refrain from eating raw or half-baked products of animal origin.
My dear friend, stay at home.